explain pain. We're going to look at outputs in this session. So we're going to think about the fact that pain is never just the only result at the end of this processing. The brain has got to call upon lots of different systems, and the idea is really that what it's looking to do is to get you out of trouble, to get you to safety, to get you away from whatever threat or danger that there is. So these systems are constantly working in the background all the time, and they're all working as different sort of systems, a bit like a thermostat, and they're all trying to sort of maintain a constant level, and they will all interact with each other. So the first system we're going to look at is our nervous system, and our nervous system is split into two different systems. On the left we have our sympathetic nervous system, and on the right we have our parasympathetic nervous system. Our sympathetic system is our fight and flight system. The idea is that it prepares us ready for action. So if there is a potential threat, it's responsible for controlling our body's response to that. So if we're under threat, we need our body to start to speed up, to tense up, to become more alert. Our heart rate needs to go up, because what we need to have is more blood flow going around our body to provide the muscles and other systems with increased amount of blood flow. Our muscles start to contract, they get sort of higher, ready to contract, ready to start to kind of move us. And we start to divert energy stores to the muscles, to our heart, to our lungs, to our brain, to prepare us ready for action. We also get a release of adrenaline and cortisol, which are different chemicals in our body, which again help us prepare and ready ourselves for doing something. So we've got this fight and flight system ready and prepared. And pain is a system that will activate this sympathetic nervous system. Our parasympathetic nervous system is essentially the opposite. So it's our rest and digest system. It's responsible for controlling our body's responses when we're at rest. It restores our body to a state of calm. It helps to decrease our heart rate, relax our muscles, and we prioritize energy for digestion, for cell healing, for sort of sleep and other things. And it helps to reduce the levels of cortisol and adrenaline back to normal levels. We said pain has effects on these systems and will activate that sympathetic nervous system. If we're in pain a large amount of the day or a lot of the time, then this sympathetic nervous system is then switched on for long periods. And it's not really designed for that. It's designed for short periods of time to get us to where we need to be, and then we can switch off and relax again. If it's switched on for long periods of the day, then essentially we're going to be using a lot of energy constantly, and that can make us feel quite tired. Our muscles are constantly in this sort of ready and prime state, and that can sometimes be a reason why we suffer things like muscle spasms and things like that. We're going to be on this edge, ready for action, but that's quite a tiring state for our body to constantly be in. And we're also going to end up with quite raised levels of adrenaline and cortisol pumping around our body, which can then affect other systems. Really what we want is our parasympathetic system switched on for lots of periods of a day, because that's how we heal and how we relax and how we settle back down and have time to digest things. So if that system's not having a lot of time switched on, again, that's going to have other negative effects for our body. Our hormone system is very important as well. It works with that sympathetic system when we're in this stress response, priming for our body ready for action. But those changes can last quite a long while. So when we release chemicals and hormones into our body, they have a relatively long-acting period of time. Threatening thoughts or memories or events can cause a release of cortisol on their own. So even just sometimes the thought or the memory of an event can be enough to sort of cause a release of these chemicals. Cortisol has similar effects to adrenaline, but these hormones act over longer time periods, so they last for sort of days and weeks rather than just a few minutes. And these raised levels of cortisol and adrenaline can start to increase our sensitivity to pain. So again, another sort of vicious cycle. Can also slow our healing rates, can affect our memory and concentration, can affect our mood and slow performance. So again, more vicious cycles in terms of when these things are, when pain is there, can affect other things which can then make our pain worse. Production of hormones do vary over the day, and sometimes that can explain why pain levels do alter throughout the day. But it's really important that we consider stress as a contributing factor for our pain, and that we therefore are looking at strategies to help manage stress, because that's a really important factor when we look at pain. We have our motor system, so our movement system, and this is to do with our muscles. Our muscles help to move us and provide stability around joints. And pain can cause some muscles to become tight and overactive. Other muscles can just switch off and become a bit lazy and get weaker. We also start to move differently when we're in pain. We adapt to other different sort of protective postures. We might tense up more, or we might sort of limp around a bit. And again, that causes us to use these muscles in different ways. So muscles are very important, but when we're in pain, pain can cause muscles to work differently to how they normally would. Fear, anticipation of pain can cause us to move differently, and that can cause movements to start to become painful. If that system's on high alert, then that muscle tone, that resting muscle activity starts to go up. You said it can start to lead to muscle spasms or other sensations in muscles. It can be quite hard to change the way we've started to move and do things. So if we have started to limp, it can sometimes be quite difficult to sort of learn to not limp again, because muscle memory is ingrained and it takes a while for it to learn new ways of doing things. But once it's learned that new way of doing things, it can be sometimes quite hard to unpick that. But it is possible, but takes time to work at it. Our immune system, again, is closely linked with our pain system. All of these systems feed off each other. So as we said, there's lots of sort of vicious cycles that happen. Our immune system produces chemicals and little cells that are mobile protective systems floating around our body. And some of these help promote, and some of these will prevent inflammation. When we're unwell and when we maybe have flu, we will have increased levels of these chemicals and cells going around our body. And we said about those chemical sensors in our body before, well, if we've got high levels of inflammatory processes going on, then it will activate some of those sensors as well as potentially some of the danger sensors. And that's why sometimes we can feel aches and pains when we are feeling unwell. Our immune system, similar to our pain system, learns and adapts over time, over our life, and it will respond again to what our body's predicting is going to happen. So increased immune activity will lower pain thresholds as well, and different sites as well as in the brain. So our pain system starts to get activated more easily. Again, stress, anxiety will also affect immune activity as well. So again, another reason why we really need to look at managing stress as much as possible. So just to demonstrate that, say, these systems don't work in isolation, this is all going back to a very kind of basic caveman-esque sort of response. So if we are under threat, we see a wolf or something like that, then we need that sympathetic nervous system to switch on to increase our heart rate, mobilize those energy stores, increase our vigilance. We start to potentially maybe sweat. We prime our motor system, our muscles, ready to run away or fight or protect us. We mobilize our hormone system, and those energy stores are sort of mobilized and ready for action. Our pain system, we motivate that. So we might potentially sort of scream in terms of attracting attention, or again, our pain system is there to help motivate us to escape or seek help if we are injured. Our immune system maybe later on then is switched on to help fight any infection or any injuries that we might have picked up, or maybe making us sleepy to help us heal overnight. And then again, later our parasympathetic system is able to switch on to help nourish and heal those tissues. So you can see that all of these systems link closely together, and our pain system works in tandem with all of these systems, and they closely affect each other. So we can have effects on our pain system by also looking at ways of trying to manage these other systems as well.